Chapter 2: Confirming Pregnancy Visiting Clinics or Consulting Healthcare Professionals. Understanding different types of tests, urine, blood. Scenario: girl discusses concerns with a parent or trusted adult. Educational notes: accuracy of tests, when to repeat testing, early medical guidance. After noticing unusual changes and suspecting she might be pregnant, the next critical step for any young woman is confirmation. At this stage, uncertainty can be overwhelming as fear, anxiety, or hope clash in rapid succession. Maya's curiosity mixed with fear. She knew that confirming the pregnancy would force her to confront the reality she had been avoiding. Yet, she also understood that knowledge would empower her to take control and make informed decisions. There are several reliable ways to confirm pregnancy. The most common is a home urine test, which detects human chorionic gonadotropin, HCG, a hormone produced shortly after fertilization. These tests are widely available, affordable, and private. For Maya, the home test had already suggested a positive result. However, it is important to remember that home tests, while highly accurate, are not foolproof. False negatives can occur if testing is done too early or incorrectly. Medications, diluted urine, or irregular cycles can influence results. Therefore, confirmation through a healthcare provider is recommended. A visit to a clinic or hospital offers multiple benefits beyond simple confirmation. Blood tests can detect pregnancy earlier than urine tests and measure hormone levels to provide information about the viability of the pregnancy. Ultrasounds can visually confirm the presence of a developing embryo and detect any complications such as ectopic pregnancy. Maya's visit to the clinic was both intimidating and reassuring. She had questions about the procedure, the results, and what the next steps would be. The nurse welcomed her concerns, explaining each step patiently and providing a sense of calm. During this visit, Maya learned that confirming pregnancy is also an opportunity to begin medical care immediately. Prenatal vitamins, especially folic acid, are crucial in early pregnancy to prevent neural tube defects. Lifestyle modifications, including proper nutrition, moderate exercise, avoiding alcohol and harmful substances, and ensuring adequate sleep form the foundation of a healthy pregnancy. These steps, though simple, have a profound impact on both the mother and the baby's health. Maya left the clinic feeling both nervous and empowered, equipped with tangible steps to safeguard her well-being. Beyond the medical confirmation, this stage also involves sharing the news with trusted individuals. Deciding whom to tell, when, and how can be emotionally complex. Maya chose to confide in her older sister first, seeking reassurance and guidance. The conversation was emotional, filled with tears, fears, and practical questions. Her sister emphasized that while the situation was challenging, Maya had options and support was available. These moments highlight the importance of building a safe support network, which is essential for emotional stability and practical assistance throughout pregnancy. It is equally important to understand the legal and healthcare rights surrounding pregnancy. In many regions, minors may require parental involvement for certain medical procedures, though this varies by jurisdiction. Understanding these regulations allows girls like Maya to navigate their options confidently. Clinics and counselors can provide confidential guidance and clarify what is required for consent, ensuring that young women are empowered rather than overwhelmed by legal considerations. The confirmation stage also presents an opportunity to begin emotional preparation. Knowing that pregnancy is real allows girls to start processing their feelings and considering next steps, whether it involves parenting, adoption, or termination. Counseling services, either through healthcare providers or school programs, provide a safe space to explore emotions, ask questions, and receive unbiased advice. Maya found that talking to a trained counselor helped her separate fear from fact, allowing her to make decisions grounded in knowledge rather than anxiety. Practical considerations are another critical aspect of confirmation. Maya started to document her menstrual history, monitor symptoms, and schedule follow-up appointments. Maintaining this information helps healthcare providers offer tailored advice and track the pregnancy's progression. At this stage, girls should also begin educating themselves about what to expect in the coming weeks, including potential symptoms like morning sickness, fatigue, and emotional changes. Understanding these signs prevents unnecessary worry and reinforces the idea that pregnancy is a natural process requiring attention, not panic. Finally, confirmation provides a psychological benefit. It transforms uncertainty into actionable knowledge. Before confirmation, Maya had been trapped in a cycle of guessing, denial, and fear. Now, with factual evidence and professional guidance, she could plan the next steps responsibly. This stage underscores a vital educational message. Awareness is empowerment. By confirming pregnancy through reliable tests and professional support, young women gain clarity, reduce risk, and begin a journey of informed decision-making. In conclusion, confirming pregnancy is not merely about receiving a positive test result. It is about establishing a foundation for medical care, emotional support, and informed choices. Girls like Maya benefit from understanding the testing process, seeking professional guidance, building support networks, knowing their legal rights, and beginning practical planning. These actions transform an intimidating situation into a manageable, responsible, and empowered journey toward the next stages of pregnancy. Key takeaways from Chapter 2. 1. Home tests are accurate but may require professional confirmation. 2. Blood tests and ultrasounds provide early, reliable results and detect complications. 3. Early medical care, including vitamins and lifestyle adjustments, is essential. 4. Building a support network is critical for emotional and practical assistance. 5. Understanding legal rights and consent requirements ensures informed decision-making. 6. Counseling helps process emotions and explore pregnancy options. 7. Documentation and awareness of symptoms prepare for the coming weeks. Thanks for watching. If you found this video helpful or learned something new, please give it a thumbs up, share it with your friends, and don't forget to subscribe so you won't miss future updates. Your support means a lot.